Good afternoon all. My paper's title is Retinopathy among patients receiving hydroxychloroquine based on OCT and HFA. Introduction. Retinopathy is any damage to retina which cause visual impairment. The role of systemic medication in causing retinopathy is very important as it is a preventable cause of blindness. HCQ is an anti-malarial drug used extensively in the treatment of autoimmune diseases. Retinal toxicity is the major and irreversible side effects of HCQ. High dose and long duration of use are the significant risk factors for developing retinopathy. AAO and Royal College of Ophthalmologists guidelines recommend the use of both automated visual field and spectral domain OCT for routine primary screening because they are widely available. Subjective screening tests like automated visual field and microperimetry, objective screening tests like SDOCT, fundus autofluorescence, and multifocal electroretinogram are used. So coming to the objective, to detect the retinopathy among patients receiving HCQ and based on OCT and HFA. Materials and methods. Study design is a descriptive study. Study period is from March 2021 to March 2022. Study setting is Department of Ophthalmology, Government Medical College, Kottayam. Inclusion criteria, all patients aged above 18 years who are being treated with HCQ for more than 1 year attending ophthalmology OPD at Government Medical College, Kottayam during this study period. Exclusion criteria, all patients with non-macular disease are excluded. Patients with media opacity which inhibit the OCT examination and visual field testing are excluded. Patients who are already taken retinotoxic drug also excluded. After taking a well-written informed consent, all patients underwent complete ophthalmological evaluation. Objective test used in my study is SDOCT, that is Topcon Mastero, and subjective test is automated threshold visual field testing, HFA. Based on the spectral domain OCT finding and visual field testing, the cases were grouped into no retinopathy, possible retinopathy, and definitive retinopathy according to Royal College of Ophthalmologists guidelines. No retinopathy means no abnormality suggestive of toxicity depending on any test. Possible means one test results typical of HCQ retinopathy but typical abnormality is not present in the other test. Definite retinopathy, both subjective and objective tests show abnormality. So coming to the result, out of 120 patients, 73.3% of above 40 years of age. And gender distribution, 90% of patients were female. Coming to the cumulative dose, 70% is having a cumulative dose of less than 500 gram and 27.5% have 500 to 1000 gram and only 2.5% have more than 1000 gram. This is the proportion of retinopathy that is found in my study is 5.8%. That means 7 out of 120 patients have retinopathy. Proportion of retinopathy, out of these 7 patients, 4 were having possible retinopathy and 3 having definitive retinopathy according to the criteria. Among 7 patients found to have retinopathy, 4 having bilateral disease also. So this is the 7 patients list where the vision was 6.6, that is the best corrected visual accuracy was 6.6 in 3 patients and 4 were asymptomatic. The duration is more than 4 years up to 8 years in these patients, and also the cumulative dose is more than 500 in all of these patients, and for one patient it is more than 1000 gram. So this is the OCT findings where the patient showing parafoveal thinning in bilaterally for one patient, foveal thinning plus disruption of ISOS junction is for 2 patients unilaterally. Parafoveal thinning and disruption of parafoveal ISOS disruption is seen bilaterally in 1 patient. Foveal thinning and ELM disruption is seen in 2 patients bilaterally. Totally 3 patients with structural abnormality noted in unilateral and 4 patients in bilateral. This is the HFA finding where 10-2 showing paracentral scotoma in 3 patients and 24-2 showing field defect in only 1 patient. So coming to the discussion, in my study, the proportion of retinopathy is 5.8%. The literature review after 2000 revealed that the proportion is ranging from 0.65% to 7.5%. There is no trend in HCQ retinopathy was noted when the age group is considered. The similar observation was noted in US-based study conducted by Wolfe and Marmer and in California-based study by Mellis and R.B. et al. In my study, those who are taking 400 mg per day dose and duration more than 5 years showed an increased frequency of retinopathy. Similar observation was stated in the study conducted by Wolfe and Marmer and Goldis, Espander et al. So conclusion, to to detect the retinopathy among the patient receiving HCQ, it was found that 5.8% of study population has HCQ retinopathy, out of which 3.3% had bilateral disease and 2.5 had unilateral disease. Out of 7 patients with HCQ retinopathy, 3 had definite toxicity and rest had possible toxicity. Out of 7, 3 patients has best corrected visual acuity 6/6, but features of retinopathy. From this, we can suggest that there is no gross defective vision in patient detected to have retinopathy in this study. Now, this may be probably due to the timely screening of the patient on the chronic HCQ usage and detecting retinopathy at its subclinical stage. Retinopathy caused by HCQ is an irreversible condition that lack appropriate treatment, and it is utmost important to detect the same at the early stage. The OCT along with visual field testing is crucial in detecting early features of toxicity. So as a preventive measure, the drug can be stopped and an irreversible blinding process can be halted. This study is a step forward in timely screening the patient on HCQ and detecting the definite features of retinopathy. These are my references. Thank you.
Okay, good study. Have you done a comparison with the visual field also? Only OCT only?
No, both visual field and OCT.
Okay. And out of 3 patients, out of 7, only 3 patients have no visual acuity affected.
3 patients, no visual acuity affected, but retinopathy is present in that patient.
So what advice you give in that patient? Can you discontinue or what is
not, dose modification is dose modification. Not discontinue because autoimmune diseases are also very important.
Okay, that means I reduce the dose or something.
Reduce the doses.
Okay. Okay, good.
Is it OCT or HFA? Specific, more specific and sensitive?
In this study, OCT was very specifically noted. All these changes were noted in OCT.